Medicines for diabetes. Taking insulin or other diabetes medicines is often part of diabetes treatment. Along with healthy food choices and physical activity, medicine can help you manage the disease. Some other treatment options are also available. Medicines for diabetes. The medicine you take will vary by your type of diabetes and how well the medicine controls your blood glucose levels. Other factors, such as your other health conditions, medication costs, and your daily schedule. They may play a role in the diabetes medicine you take. Type 1 diabetes medication. When you have type 1 diabetes, you must take insulin because your body no longer makes this hormone. You will need to take insulin several times during the day, including with meals. Moreover, you also could use an insulin pump, which gives you small, steady doses throughout the day. Type 2 diabetes medication. Some people with type 2 diabetes can manage their disease by making healthy food choices and being more physically active. Many people with type 2 diabetes need diabetes medicines as well. These medicines may include diabetes pills or medicines you inject under your skin, such as insulin. In time, you may need more than one diabetes medicine to control your blood glucose. Even if you do not take insulin, you may need it at special times, such as during pregnancy or if you are in the hospital. Gestational diabetes medication. When you have gestational diabetes, you should first try to control your blood glucose level by making healthy food choices and getting regular physical activity. When you can't reach your blood glucose target, your healthcare team will talk with you about diabetes medicines, such as insulin or the diabetes pill metformin, that may be safe for you to take during pregnancy. Your healthcare team can start using diabetes medicine right away if your blood sugar is very high. No matter what type of diabetes you have, taking diabetes medicines every day can feel like a burden sometimes. You may also need medicines for other health problems, such as high blood pressure or high cholesterol, as part of your diabetes care plan. Different types of insulin. Medicines for diabetes. Several types of insulin are available. Each type starts to work at a different speed, known as onset, and its effects last a different length of time, known as duration. Most types of insulin reach a peak, which is when they have the strongest effect. Then the effects of the insulin wear off over the next few hours or so. The chart above gives averages. So, follow your doctor's advice on when and how to take your insulin. Moreover, your doctor might also recommend pre-mixed insulin, which is a mix of two types of insulin. Some types of insulin cost more than others, so talk with your doctor about your options if you're concerned about cost. You can learn the story of fighting diabetes naturally without the use of drugs and insulin, here. Different ways to use insulin. The way you take insulin may depend on your lifestyle, insurance plan, and preferences. You may decide that needles are not for you and prefer a different method. Therefore, talk with your doctor about the options and which is best for you. Most people with diabetes use a needle and syringe, pen, or insulin pump. Inhalers, injection ports, and jet injectors are less common. Needle and syringe. You'll give yourself insulin shots using a needle and syringe. At the same time, you will draw up your dose of insulin from the vial, or bottle, into the syringe. Insulin works fastest when you inject it in your belly, but you should rotate spots where you inject insulin. Other injection spots include your thigh, buttocks, or upper arm. Some people with diabetes who take insulin need 2 to 4 shots a day to reach their blood glucose targets. Meanwhile, others can take a single shot. Pen. An insulin pen looks like a pen but has a needle for its point. Some insulin pens come filled with insulin and are disposable. Others have room for an insulin cartridge that you insert and then replace after use. Insulin pens cost more than needles and syringes, but many people find them easier to use. Pump. An insulin pump is a small machine that gives you small, steady doses of insulin throughout the day. You wear one type of pump outside your body on a belt or in a pocket or pouch. The insulin pump connects to a small plastic tube and a very small needle. You insert the needle under your skin and it stays in place for several days. Insulin then pumps from the machine through the tube into your body 24 hours a day. You also can give yourself doses of insulin through the pump at mealtimes. Another type of pump has no tubes and attaches directly to your skin, such as a self-adhesive pod. Inhaler. Another way to take insulin is by breathing powdered insulin from an inhaler device into your mouth. The insulin goes into your lungs and moves quickly into your blood. Inhaled insulin is only for adults with type 1 or type 2 diabetes. Injection port. An injection port has a short tube that you insert into the tissue beneath your skin. On the skin surface, an adhesive patch or dressing holds the port in place. You inject insulin through the port with a needle and syringe or an insulin pen. The port stays in place for a few days, and then you replace the port. With an injection port, you no longer puncture your skin for each shot, only when you apply a new port. Jet injector. This device sends a fine spray of insulin into the skin at high pressure instead of using a needle to deliver the insulin. Oral medicines for type 2 diabetes. You may need medicines along with healthy eating and physical activity habits to manage your type 2 diabetes. Moreover, you can take many diabetes medicines by mouth. These medicines are called oral medicines. Most people with type 2 diabetes start medical treatment with metformin pills. Metformin also comes as a liquid. Specifically, metformin lowers the amount of glucose that your liver makes and helps your body use insulin better. At the same time, this drug may help you lose a small amount of weight. Other oral medicines act in different ways to lower blood glucose levels. So, you may need to add another diabetes medicine after a while or use a combination treatment. Combining 2 or 3 kinds of diabetes medicines can lower blood glucose levels more than taking just one. You can learn the story of fighting diabetes naturally without the use of drugs and insulin, here. Other injectable medicines for type 2 diabetes. Besides insulin, other types of injected medicines are available. These medicines help keep your blood glucose level from going too high after you eat. They may make you feel less hungry and help you lose some weight. Other injectable medicines are not substitutes for insulin. Side effects of diabetes medicines. Side effects are problems that result from a medicine. Some diabetes medications can cause hypoglycemia when you don't balance the medication with food and activity. Ask your doctor whether your diabetes medicine can cause hypoglycemia or other side effects, such as upset stomach and weight gain. Take your diabetes medicines as your healthcare professional has instructed you, to help prevent side effects and diabetes problems. Other treatment options for diabetes. When medicines and lifestyle changes are not enough to manage your diabetes, a less common treatment may be an option. Other treatments include bariatric surgery for certain people with type 1 or type 2 diabetes, and an artificial pancreas and pancreatic islet transplantation for some people with type 1 diabetes. Bariatric surgery, also called weight loss surgery or metabolic surgery. Bariatric surgery may help some people with obesity and type 2 diabetes. It helps to lose a lot of weight and restore normal blood sugar. Some people with diabetes may no longer need their diabetes medicine after bariatric surgery. Whether or not blood sugar levels improve and for how long seems to change depending on patients, type of weight loss surgery, and how much weight the person lost. Other factors include how long someone has had diabetes and whether or not the person uses insulin. Recent research suggests that weight loss surgery also may help improve blood glucose control in people with type 1 diabetes who are obese. Researchers are studying the long-term results of bariatric surgery in people with type 1 and type 2 diabetes. Artificial pancreas. An artificial pancreas replaces manual blood glucose testing and the use of insulin shots or a pump. A single system monitors blood glucose levels around the clock. At the same time, provide insulin or a combination of insulin and the second hormone, glucagon, automatically. The system can also be monitored remotely, for example by parents or medical staff. In 2016, The FDA approved a type of artificial pancreas system called a hybrid closed-loop system. This system tests your glucose level every 5 minutes throughout the day and night, and automatically gives you the right amount of insulin. You still need to manually adjust the amount of insulin the pump delivers at mealtimes. However, the artificial pancreas may free you from some of the daily tasks needed to keep your blood glucose stable, or help you sleep through the night without the need to wake and test your glucose or take medicine. The hybrid closed-loop system is expected to be available in the US in 2017. Talk with your healthcare provider about whether this system might be right for you. The devices may also help people with type 2 diabetes and gestational diabetes. Pancreatic islet transplantation. Pancreatic islet transplantation is an experimental treatment for poorly controlled type 1 diabetes. Specifically, pancreatic islets are clusters of cells in the pancreas that make the hormone insulin. In type 1 diabetes, the body's immune system attacks these cells. A pancreatic islet transplant replaces destroyed islets with new ones that make and release insulin. This procedure takes islets from the pancreas of an organ donor and transfers them to a person with type 1 diabetes. Because researchers are still studying pancreatic islet transplantation, the procedure is only available to people enrolled in research studies. Note: diabetes is a dangerous disease with many complications related to the kidneys, heart, liver, and causes many serious health effects. Understand the causes and prevention of the disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action, and start enjoying the benefits. Reference: Diabetes Freedom, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falandafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.